Hi everyone, welcome to Get Well Physiotherapy and Foster Healthcare. I'm the senior physiotherapist in Get Well Physiotherapy and Foster Healthcare. Today I'm going to talk about some basic exercises of tennis elbow or lateral epicondylitis. Usually tennis elbow is when we have pain at the lateral side of our elbow at this point. This point we have a bone called lateral epicondyle area. In the bone, that point is called lateral epicondyle. I'm not going in detail into anatomy. From that lateral epicondyle, the extensor muscles are attached. So when we do more of this movement, that is the extension of the elbow movement, then we get this lateral epicondylitis or tennis elbow. Also this movement, when we are doing this moving our wrist like flexion extension. So this is overuse injury of the lateral epicondylitis or overuse injury of the extensor muscles. And when we have pain at the medial part of the elbow, this part we call it golfer's elbow, because that pain usually comes when we do more of the flexion movement, not that this is the extension and this is the flexion. So now coming to the basic exercises of lateral epicondylitis or tennis elbow. When you feel little pain at the lateral side of the elbow, you can start doing these exercises. But if the pain is too much, if you feel you can't bear that pain and it's like pokey type of pain or anything, or you had any injury, then you need to go and see orthopedic doctor or orthopedic physiotherapist. So coming to the exercises, first exercise will be the wrist exercise, just the normal range of motion of the wrist. This is extension of the wrist and this is flexion of the wrist. So do this 10 times like this. 1, this will complete 1, and then 2, like that 10 times, the first exercise. Second exercise, you have to stretch this extensor muscle. For stretching that with the other hand, you have to press your wrist like this and hold it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then release, and then again you have to do this flexion of the wrist, and how much it can go. You may feel some pain, some stretching pain here, and while doing this some stretching pain here, that is completely normal. But if the pain is severe, then you need to check with your doctor. Okay, so second exercise will be stretching of the wrist. Same 10 times repeat, 10 seconds hold. Third exercise will be supination and pronation. Supination is this. Let me just move the camera a little bit behind so you can see it. Okay, supination is this movement and pronation is this movement. So when you are doing this supination and pronation, make sure your hand is always on a table. You better if you don't do it like this. You have to support your hand, and also you can hold this part, upper arm, with other hand, because you are not moving this from your shoulder, you are moving it from your elbow joint. So supination and pronation, I am moving it from here, not from here. Okay, so if you are moving it from your upper arm, means you are doing shoulder exercise, but we are doing it from the elbow. Same way, 10 times supination, 10 times pronation, like this. You don't have to hold it, you just have to repeat 10 times. This is the third exercise. The fourth exercise will be extension and flexion of your elbow. This is extension, and just do the flexion like this, extension and flexion. Same 10 times extension, 10 times flexion. So these are mainly the stretching exercises for your elbow joint. Now coming to the strengthening exercises. For strengthening exercises, you need to take some weight. Weight means you can take 1 liter of water bottle or a book or anything, but not more than 1 kg weight. 500 to 1 kg of weight. So I have this weight thing. So with this, I'm just going to show you the strengthening exercises. For strengthening, you need to hold it like this. You can hold that water bottle. I don't have a water bottle here. So like this, and then you have to just move. I'll show it from sideways. So you have to do extension of the wrist, holding it, and then flexion. You may have some pain because if your muscles are weak from here, you may feel some pain, but you can do this exercise with 1 kg weight or 1 liter of water bottle. Okay, extension and flexion. So extension 10 times and flexion 10 times. You don't have to hold it. You don't have to hold for 10 seconds or anything. Just do flexion and extension. Okay, and coming to the next strengthening exercise, that will be ulnar deviation and radial deviation. This is ulnar deviation of the wrist and this is radial deviation of the wrist. Maybe you are thinking that I have pain in my elbow, but why I am giving the exercises for wrist? Because this muscle, the muscle that is injured or the muscle that got overused injury, that muscle is attached from the lateral epicondyle to this wrist part. So you have to, when you are strengthening the wrist joint, it's strengthening this extensor muscle. Next will be this ulnar deviation and radial deviation. So for that you have to hold this weight and do this ulnar deviation 10 times and radial deviation 10 times. You can keep your hand like this and do this. Okay. Mainly this is the exercise, and the last exercise will be you have to hold some stick or you can hold some umbrella and do this movement. That is also stretching and strengthening. That stick or that umbrella or whatever you are holding, even you can hold that water bottle, 1 liter of water bottle, and then you can just do this movement. So these are the main basic exercises for lateral epicondylitis or tennis elbow. Sometimes with this exercise you don't get relief from this pain, then you have to go to an orthopedic physiotherapist for the treatment, because when you have lot of inflammation and if you have tissue damage, then they need to give you some modalities, and also if there is any trigger point or anything, they will release that, and after that they will give you exercise and you can start these exercises as well. So these are the basic exercises. Thank you for watching my video. If you like my video, please don't forget to subscribe to my channel Get Well Physiotherapy. I will give other basic exercises also. And if you have any comments or questions, please don't forget to write in that comment section below. I will reply you. Thank you and have a nice day. Bye bye.